Thank you, Prof. Badr. We can promise you a very exciting first session, inshallah. Our first speaker for today is Professor Abdul Min'am Sahl Al-Mardi. He's the director of the Education Center at Al-Ma'rifa University. He received his medical degree from Al Khartoum University and then his MPhil and PhD from the University of London. He's an anatomist / neuroscientist as well. After receiving his certificate in health professions education, which was initiated by the Gulf Corporation of Council of Deans, back in 2003, he shifted directions toward medical education. And his interest and activity in medical education grew, maintaining his relationship, of course, with the anatomy as a professor of neuroanatomy. Now, today's talk, he's going to talk to us about a very important medical education outcome, which is basically patient safety. I remember 7 years ago at Al Faisal University, we established a student club that was responsible for, awareness of patient safety and so on. Back then it was a strange idea. It did not receive the attention that it deserves. Now everybody's talking patient safety, and it's going to be an important outcome. Dr. Abdul Al-Mardi's interest in patient safety and his relationship with patient safety started back in 2012, when he was asked to translate a proposed WHO curriculum into a course in the College of Medicine at Al-Imam University in 2012. So without waiting further, I'd like for Prof. Al-Mardi to come on stage, please.
Thank you very much, Prof. Badr and Prof. Akif, and thank you for the attendees for showing up this early in relation to others. I just want to emphasize one point mentioned at the end of the introduction, that I am honored to have two of my deans present, Professor Khalid Abdurrahman and Dr. Khalid Al-Gomezi, and they were both at Al-Imam University when I was assigned the role of actually translating the WHO curriculum into a course. In my presentation, I'm going to cover 6 aspects, and you will realize that are all related to تحت وين؟ هنا؟ هنا okay. The 6 aspects are: what is patient safety? Definition first. ما اللابتوب ما موصل. اللي تحت ولا اللي فوق؟ اوكي. خليك من الجنب ده. وشاور على هنا. لا عندكم انتوا هناك. اوكي طيب. I'm going to discuss what is patient safety very quickly, and then the rationale. Why do we need to teach patient safety? And then when in the degree plan, and then learning and assessment, how it should be taught, where should it be taught, the location, and finally, who is the owner of the patient safety course. These 6 aspects are actually when what why, who, how, and where of anything. So the first issue is the teaching. What is patient safety? Patient safety is associated with a widely quoted statement. It is related to this statement, and the statement is actually a primum non nocere, which is translated, first do no harm, and we all heard about it. This statement, the origin of this statement is controversial. People say it is said by Hippocrates, probably inaccurately attributed to Hippocrates, said to be part of the Hippocratic Oath, but if you look at the oath, it is not there. But some people say maybe it is in Hippocrates' other book, which is called Of the Epidemic. Maybe it is in the other book, but if you check this book, it's also not there. So the origin of this statement on which patient safety, the issue of patient safety, is founded is not known. So also, first do no harm is also associated with an important concept and principle, which is the principles of medical ethics, and it's called non-maleficence. Now, this statement was criticized because it assumes that if we do not remind practitioners of this, they will do harm to patients. So it assumes that the major effect of medical intervention is harm. So it was critiqued or criticized by some of the authors, and it is sometimes ridiculed. You can see it in cartoons. For example, in this cartoon it says, this is the oath, first do no harm, after that go nuts. So it is often used in cartoons to ridicule the statement itself. So the statement is controversial, and this is nevertheless, it is the foundation of patient safety. First, do no harm. Another important statement related to patient safety is to err is human. And this is an important principle associated with patient safety, and it was first noticed when a report by the Institute of Medicine was published, and the title of the report is to err is human. And of course, you know, الحديث اللي بيقول كل ابن آدم خطاء. For the same statement was used as a title for that report. In that report, which was published in 1999, they reported large numbers of deaths, hospital deaths. And it's actually invited an outcry from the media. They spoke about the report for several weeks to come. But that was not their major concern. That was not their major issue. The recommendations actually was the starting point of the movement of patient safety. And this was in 1999. Since then, it received and is still receiving a lot of attention as a practice concept. Now, other books were published in the issue, especially by the Institute of Medicine, because they started publishing on the different aspects of patient safety. Now, and there was a strive by the profession to strike a balance between helping patients and avoiding harm. Now, as far as the teaching of patient safety is concerned, did not receive the same attention as the attention received by practice. But a number of publications were published in the first decade of 2000. And from 2000 on, after the report, there are many publications about the issue, and most of the publications were evaluating how people are addressing the issue of patient safety in their curriculum. For example, this one is teaching medical students about medical errors and patient safety evaluation of a required curriculum. This was in 2005. So if you can, if you go through the literature, you will notice a gap between 1999 and the first reports about the teaching of patient safety. There is a lag of 5 years before academia started to pay attention to the issue of patient safety and how it should be taught. Another report, Changing and Sustaining Medical Students' Knowledge, Skills, and Attitudes about patient safety of medical, this was 2006, and so on. I'm just flashing them to show you that during the first decade of the 21st century, people started publishing about the teaching of patient safety. Now, one of the important publications on the issue was a survey, and in that survey, they noticed that only, it was published in 2009. Very important because 10 years after To Err is Human, the publication of the report, there was some evaluation of what people are doing and the result of that. They actually investigated interns and residents. So 25% of the institutional members reported that their schools had explicit patient safety curricula. So in 2009, they discovered that a number of institutions, but only 1/4 of the institutions they investigated reported that they have a curriculum. Now, the curricula used lectures and small group instruction, and more likely in the preclinical phase of the curriculum. This was at the milestone, which is 2009. Now, in 2009, some report reflects the outcome, and not the teaching itself. And then in 2009, the WHO stepped in and published a patient safety curriculum guide for medical schools, and later on they published another version for other healthcare professionals, or it was called multi-professional edition. This is for the medical schools, and the other one is for multi-professional, including the medical schools. Now, it has got 2 parts. Part A was a guide for the teachers on how to implement the patient safety curriculum, while Part 2 covered the topics to be covered in the course. That guide has got teacher guide, which is the first part, and it goes the curriculum guide topics in the second half of the document itself. Now, I'm going to involve you in some sort of a poll. Can you please take out your phone, because in a minute I'm going to ask you about patient safety. Now, the guide was based on important documents. One is the National Safety and Quality Health Services Standards. The other one is the Australian Patient Safety Education Framework, and the third one is the International Patient Safety Goals of the JCI. Now, these 3 documents were the foundation for the guide issued by the WHO. Now, this is the framework, the National Safety Equality Service, and this is the National Patient Safety Education Framework by the Australian. And this is the patient safety goals of the JCI. Now, these formed the foundation for the guide, and they tried to answer the questions of what to teach, how to teach it, who should teach it, etc. The 6 W's I mentioned at the beginning of my talk. Now, can you please log in through your browser to Poliv, which is Pol everywhere, Poliv/Abdulmunaim, is spelled ABDELMONIEM, then E558. Hiding the screen. Poliv is Pol, P-O-L-L-E-V, poliv.com, poliv.com. Then /Abdulmunaim, ABDELMONIEM, M-O-N-I-E-M, Abdul Muniem, E558. ما هم اللي بحسب اسمك يعني. ايوه احنا المره الجايه ان شاء الله. طيب. Have you logged in? Because I am expecting your responses there. E558 at the end after Abdul Munim. E558. By the way, is the laptop connected to the internet? This laptop. Because if it is not, then we will not see the answers. ما انتبهت. Connected? Okay. Why? Have you connected and tried to answer the question? Have you seen or read this patient safety curriculum guide? Have you seen it before? It was published 2009. 11 years old. Yes, I have seen it and read it. Yes, I have seen it but did not read it. No, I have not. Pick your answer if you could open the poll. ما هي مفروض automatically إذا connected. Okay, let me go to the other slide, which is the patient safety curriculum integrated in your medical curriculum? I wanted to see some answers, but اوكي طيب على الاجابات الاربعه دي الاجابه الاولى yes as a standalone course. Who has this course patient safety as a standalone course? امام وملك سعود. وين اي جامعه؟ yes I received it. Yes. I think multi-professionally taught, multidisciplinary. Yes, taught by surgery, medicine, all of them. Yes. Which university? Oh, yeah, okay. Okay, who has it as a standalone part of a pre-existing course, merged with another course? Anybody? Yes, as a concept weaved into pre-existing courses. Not standalone content, but bits and pieces here and there in different courses. No? Not at all. معناه الباقيين not at all. You don't have courses related. Prof. Hamza, you said you have it.
I'm sorry, I was busy with the
The first question, the first one, is it a standalone course?
Yes.
Standalone course. يا ما بروفنا قالت هاي إنه كين سعود يونيفرسيتي الإمام جيزان. Very quickly, if we see who is attending, not who, but the number of attendees, 2 out of, say, 20, about 10% of the attendees, not of the colleges of medicine so this is the point I was trying to make. The other point, I wanted to see whether people have heard of the WHO guide. So can we go and answer that question? Have you seen it and read it? Yes. The guide? Yes, of course. And you gave it to me to translate. Well, very so, of course. You have a copy of the guide itself, huh? Yes, from Canada. So, the point I'm trying to make is, although it was published in 2009, still it didn't find its way through to medical colleges so that they deal with it. I attended a conference 2 years ago by the Saudi Center for Patient Safety, and they actually had a big workshop about the teaching of patient safety. And the report was still similar to today. Only 6-7% of colleges, health science colleges, not only medical colleges, implemented the curriculum of patient safety. So there is an issue. We would like to discover what that issue is. Of course, I wanted to ask people about the topics, since not many of you have seen the guide, but these are the topics listed in the guide. Those who saw it know that 8 of the topics are general topics, and 3 of them are applications of patient safety. We will deal with this again when we come to that. Actually, in 2019, the Saudi Commission for Health Specialties issued a guide called Essentials of Patient Safety, the first step to proper health care. And this guide is actually addressing the issue of teaching of patient safety or training on patient safety. And if you look at it and you look at the topics in the guide, they are almost the same. So they adopted the issues, the topics in the guide as issues to be covered in patient safety, and they addressed how the question of who, how, where, and all of those questions. So these are the topics, general topics like human factors in healthcare, the ergonomics, the medication errors, infection control. These are the major topics. And for those topics, they actually listed learning objectives. They listed what sort of knowledge needs to be learned, what sort of skills, all found in. So it's a great help. The guide is an excellent guide if you want to implement a patient safety curriculum in your degree plan. Now, in the teacher's guide, they also listed issues related to how you can do it. So as you can see from point number 5, implementing the curriculum guide, how to do it, how to integrate patient safety into your medical curriculum, educational principles essential for patient safety, how to assess patient safety, etc. So in detail, they told you about everything in that guide. So if you are interested in implementing, you don't need to go any further, because the report took into consideration all the previous experiences, and they actually issued an evaluation form, and I will tell you later about when it was used in US, what were the results. So this is about what to teach. What to teach, the 11 issues listed in the WHO guide. So tips about what should be taught is agreed upon, especially after the WHO guide was published. All the publications after the guide adopted the 11 topics. So there is no need to go and benchmark and look around. The 11 topics are already agreed upon in the guide and thereafter. When teaching patient safety, it should be very clearly defined together with all the relevant terminology. So this was the first recommendation in the teaching. And then the focus should be in defining what is error. This is why I started by the report to err is human. The issue needs to be explained to learners as that error is human, it is unintentional, and it is preventive. This is a major issue in the teaching of patient safety. Now, the issues, the topics to be covered are divided into 2. The first 8 are general topics, and they should form the foundation of the applied topics. And why the interest and why the emphasis is because most of them are missing in medical curricula. So we don't teach the human factor and ergonomics. Some colleges teach quality and leadership. So the issues that form the foundation for the teaching of patient safety are often ignored in the medical curricula. This is regarding what to teach. Why teach it? I will go through it very quickly because it is obvious. Why? Of course, about medical errors and what they cause. In the United States, 400,000 patient deaths annually due to preventable harm. Patient safety is increasing focus in healthcare delivery. You hear about it everywhere now. So you need to pay it some attention in your curriculum. The third point is it is now recognized as the responsibility of the entire healthcare team. So for medicine, for pharmacy, for nursing, they all need to address the issue in their curriculum. Now, and all the publications that studied curricula, they studied the curricula to see whether patient safety in total or in whole or partially is present here and there. They found that it's not adequately addressed in the curriculum. Now, more guides were issued. Some were issued before the WHO guide. So if you need to just look for further evidence, there are more guides. The most important of them is this report by the Lucien Leap Institute. It's called Unmet Needs, and it addresses some of the issues you might need as additional issues when you are. Let me rush. So the rationale is publications. Many publications on the issue, they said there is a need for the teaching of patient safety. Some of them are systematic reviews, some of them are scoping reviews, publications, all of them, they all confirmed the need for the teaching of patient safety. Now, in the guide, there is an implementation guidance, and to me, the implementation guidance is adequate. You don't need to go any further than the guide, and they give some recommendations on how you can manage this transformation or this change towards the use or the teaching of patient safety. So they give you recommendations on how to do it, and these recommendations are quite practical, and they are put in a practical sequence. Now, this point I need to address. You can teach it, I asked, because some opted for teaching it as a standalone course. And a standalone course can be introduced into traditional curricula. We still have some of those, and in integrated curricula. In the integrated curricula, the best place for them, they say, is the second year, because in the first year, students are barely introduced to clinical medicine. So this is where they think. So this is a standalone course. If you want to integrate the content, you can integrate it into pre-existing modules as standalone content. So it's standalone content, but it is in pre-existing courses. Or you can weave it in other curricula. But the general consensus, the best approach is to have a foundational course at the beginning, and then you weave the remaining components into your existing curricula. So this is how they see this approach can be done. It's called the hybrid approach. So when to teach it in the curriculum is up to your environment, and you can opt for, but most of them indicated that having it halfway in the program is best. Halfway, not too early and not too late. And the learners are already exposed to some clinical environmental issues, and some of the foundational components and concepts can be introduced earlier in related or relevant courses. Now, learning and teaching, very obvious. You need to use innovative approaches in education. And of course, you all know the SPICES model, and they use the first three of them: student-centeredness, problem-based education, and integration. These three are the best for, so they said innovative approaches are best for the learning and teaching and assessment of patient safety, including student-centeredness, problem-based learning, and integration. Now, learning from errors and through them should be the major focus, and there is a new concept I would like to introduce very quickly. These are the recommendations how to do it as far as teaching is concerned. There is a concept introduced by Dr. Drew in 2011. It is called learning from experiencing error, not We do not train them how to avoid error. We train them through having them experience the error and then deal with it. So this is a new concept introduced 2008, and it is chapter 34 in the Practical Guide for Medical Teachers. You can read about it there. It is about how they can learn by experiencing error, not by trying to prevent error. This is the latest edition, and Dr. Durur wrote a chapter on that about patient safety in chapter 34. This is related to how it should be taught. Tips about how: evident, innovative approaches, student-centeredness, using cases and problem-based learning approach, reported to have excellent results. As collaborative healthcare is a trend, it is advised that it is taught interdisciplinary and interprofessional. You bring the disciplines together and you bring the professions together to teach patient safety, because now collaborative healthcare is a trend. Before finally, where should it be taught? They said most of the reports indicated that it can be taught in the college most of the time, but they need to go to the hospital to actually experience the environment and experience the type of error that occurs every day. So they go through to be exposed to the error. So both in the college and the healthcare facilities. In addition to lectures, course-based small group discussion sessions, tutorials, etc., even role play and practical sessions can be used. And facility-based placement and visits are important for the environment and experiencing the errors. Finally, who is the owner? There is controversy on who should teach and who should be responsible for the course or courses. And this is my last point. Who teaches what and who coordinates should be agreed upon. Who is the coordinator? Depending on the nature of the course and program, depending on the nature of the course, you say, are you going to go for a standalone? Are you going to go for content in a pre-existing course, hybrid approach? Depending on the nature of your course and the nature of your program. Is it a traditional program? Is it an integrated program or what? Depending on that, the responsibility will be agreed upon, who should teach and who should coordinate. Most of the studies recommended that the Department of Medical Education should be responsible for that, and that it should be interdisciplinary and interprofessional. So who is teaching, who is responsible, interdisciplinary and interprofessional? In conclusion, Prof, in conclusion, the issue of patient safety received attention for the past 20 years from the medical professional and the medical educators alike. It received attention, but was it rolled out in curricula? Not quite. So several documents and guides were published. The WHO guide is fantastic. You can use it. The various aspects of implementation were intensively studied, indicating that the issue is still evolving. You can see publications even 2021 about the issue. It means it is not yet settled, this issue of patient safety and the teaching of patient safety. Although it is doable, it is challenging. Reform, this is an important advice from all the publications. Reform the environment before reforming the curriculum. Don't prepare a patient safety curriculum in isolation through a committee and bring it to everybody and say this is a patient safety curriculum. Do it. You need to reform the environment first, preparing it for the introduction of patient safety.